So good morning, everybody. As Carol said, my name is Bea McDonough, and I'm going to start off this morning. We're going to be playing kind of tag here. I'll be starting off introducing, giving the context of the project, and then Michelle will talk about the methodology and the results. Then I'll come back and I'll talk a little bit more about the KT action strategy that we're doing. So this project is a partnership between the Public Health Services Department of the City of Hamilton in the Workplace Wellness Chronic Disease Prevention area and the Department of Family Medicine research team. Canadian Diabetes Association Hamilton branch is also a partner on this project, as well as the Workers' Occupational Health Clinics in Hamilton. And we also have two champion carrier organization transport companies that are step forward to be partners on this project with us, and it's CIHR funded. So the objectives for today is to describe a collaborative partnership with the community champions in the transport sector to develop a health and wellness survey for truck drivers, to identify the health needs of a high-risk, marginalized population of primarily male truck drivers, what we found in our survey, and to discuss innovative collaborative knowledge transfer action strategies. So wherever we've gone in the last few months since the release of the survey, everyone always asks us, why truck drivers? Why are you working on truck drivers? So the next 3 slides will go over exactly why we chose this group as a population to work on. In public health, there's a focus on subpopulations and priority populations, and we identified this population, primarily males, marginalized, difficult to reach, have difficulty accessing primary care services because of the hours they work. So we chose this population, and the 2006 census data indicate that truck drivers is the second most prevalent occupation for men in Canada. So there's a large number of men who work in that occupation. In terms of the Trucking in Canada survey, they identified that there's about 183,000 carriers within Canada, and 73,000 of them are located within the province of Ontario. A large number of truck drivers, about 20% of them, not a large number, but 1 in 5 are independent drivers, meaning that they own their own cab or they rent it. And they're responsible for the maintenance and the operations of that cab. Their workplace literally is their cab and the road and the truck stops that they stop at. They are in their company that they work for a very short period of time. And because they work often 17 hours a day, it's very difficult for workplace policies to have an impact, or workplace programming to have an impact on this lone worker population. So again, why truckers? The trucking industry plays a major role in the Canadian economy. 53% of products that are exported to the United States and 76% of the products imported to Canada arrive by truck. So it has a tremendous impact on the economy. And in the Trucking for Canada recent report, they identified that the aging workforce is a big concern for the trucking industry. A lot of the drivers, and you'll see this in the results, have worked for a long time as a driver, and most of them are over age 55, but we'll get into that a little bit later. So to recruit and retain young drivers to be able to keep the economy going is almost at a crisis position right now in Canada. A lot of drivers don't like the lifestyle. They don't like the long hours. They don't like the commitment. They don't like the independence. So they're almost at a crisis situation in Canada with the trucking industry. It's the occupation with the highest lost time injury in Ontario. Truck drivers have a higher than average health risks and poorer than average lifestyle behaviors, in large part due to the working environment. The Trucking in Canada report also indicates that truckers are at risk because of the long hours. Usually a 70-hour week. We work, on paper anyway, 35 to 40 hours a week. Many of us work more than that, but that's our own choice. They work 70 hours a week. 17 hours a day is a typical work day for a truck driver. So it's a lifestyle that not many can be comfortable being involved with. Very few drivers take advantage of the benefit programs. if they are hired as an independent worker by a trucking company, they can either opt in or opt out of the benefits. And many opt out of the benefits, particularly the retirement benefits, compared to 44% of other occupations. So if they're not opting into the retirement benefits, they have to set aside a portion of their money for their own retirement. And there's evidence that not many of them are doing that on a consistent basis because they are just working to try to keep up the lifestyle that they had several years ago. The design team that we work with, which is composed primarily of truck drivers, have said to us that 15 to 20 years ago, truck drivers had a really good salary. They got paid well for their job, but over the last 15 to 20 years, there's been no increase in salary compared to the inflation, the cost of gas, the cost of upkeeping their cabs. The regulations change on a regular basis, that they have to change the flaps of the truck, or they have to upgrade the technology within their cabs, but they don't get paid for that. That comes out of their money that they make. So they're finding that they're working longer hours just to keep the lifestyle that they accumulated 15 years ago. Because of the uncertainty in the industry, and there is a great deal of uncertainty because of the high gas prices, the cost of the equipment, and the aging workforce, and the Department of Transportation in the States is looking at implementing screening for sleep apnea and BMI guidelines. And the Canadian industry realizes that what happens in the States will come to Canada. So again, many of the drivers, and you'll see the results, many of the drivers are concerned about maintaining their jobs because they won't meet the requirements when they come up here. And how will they work with the drivers to help them meet those standards when they are set? So it's a highly competitive sector. If one trucking company decides that, no, I can't push my drivers more to take that request for a customer to get the widgets for their car making or to have food delivered, there's always another trucking company down the street that will undercut them. So it's a very competitive business, and they're really feeling the pinch on that. And we found that about 30% of the trucking companies in Canada are unionized, very unlike the States, where most of the trucking companies are unionized. So that affects the working conditions because you don't have the pressure from the union to implement more policy changes or implement more pressure on the companies to do some things. So it's a very different scene in Canada than in the States right now. The Trucking Association of America did a health screening study in 2007 and found that 49% of the drivers were obese. That means having a BMI more than 30. 39% were overweight, a BMI between 25 and 29, and 31% had high blood pressure. And in the companies that we worked with, blood pressure was often the #1 cost for benefits in terms of medication, that and diabetic medication. And some health issues such as high blood pressure and diabetes, sleep apnea and stroke can limit a driver's ability to work. There's very strict guidelines in terms of diabetes. Your blood sugar cannot be over or less a certain amount before you can drive after a lunch, and you have to have regular checking on a regular basis. So there's a lot of constraints in the trucking industry, a lot of issues that are affecting the trucking industry. And the trucking industry in Canada is different than the trucking industry in the States. Similar risk factors for chronic disease, but differences in terms of how we're set up at the company level, the organizational level. And we found that there was very little Canadian data on the prevalence of risk to inform programs and strategies. So those 3 slides kind of summarize why we felt this was a priority population that we wanted to target and to work with. We know workplace conditions affect health. Work time lost in Canada has increased from 7 days per worker in '67 to 10 days in 2008. Employees in good health are 20% more productive than those in poor health. The average direct cost to an employee absenteeism is about $3,500 per employee, and combined with indirect costs, that increases to 17% payroll costs. And employees who have 3 or more risk factors, that is, say you are physically overweight, say you smoke, say you are overweight as well, are more likely to have 50% more absences from work compared to employees who do not have these risk factors. And you will see that many of the drivers have 3 or more of those risk factors on a regular basis. Plus, truck drivers are considered lone workers. In the literature, they're similar to construction workers, lone workers, people that work in the mines, airline pilots. They have a unique workplace setting. They're not in their workplace on a regular basis. And because if they work a 17-hour day, a workplace program may not work for them unless it's geared more towards their independent lifestyle or the technology that's within the truck. So you have to be a little innovative in working at programs to address their health needs. Policies would certainly work for them because the company would have a policy that might affect all of the drivers. But because of the workplace setting, programs are very difficult workplace prevention programs. So the objectives of the survey were to design and pilot a survey instrument to determine the prevalence of health conditions, risk factors, and health behaviors, and to characterize contributing working conditions, and to provide a basis for a larger national study on the health of truck drivers. So Michelle will now give you more details.
Okay. So just to briefly review the methods that we used in developing and administering our survey. We started to develop our survey in a couple of ways. So we looked at relevant published surveys where available, so where we could take surveys that were already in use and validated and had some evidence behind them to get the questions that were already working rather than devise new ones. And then to supplement that, we did some focus groups with the industry with our 2 champion companies that have been working with us since the start to understand and make sure that we've captured all the important issues for health in this population and to make sure we understood the language and the appropriateness of the questions from the literature and to design a few new ones that we needed to add in. Next after doing that, we pre-tested our survey instrument pilot that we put together with a group of drivers in one company to make sure that the language and the clarity and everything was okay and to see what the length of it was and if it was going to work okay. And then we went and administered it with a lot of guidance from our company, 2 champion companies again, on how we would implement this in this population to get people to buy in and complete it, because it was, of course, voluntary. So the purpose of the focus groups, as I mentioned, was to elicit the range of issues of work, lifestyle in their relation to health in terms of getting the questionnaire right. And we had 2 companies that have been working with us since the beginning, and we had 1 focus group with managers from each company and 1 focus group of employee drivers separately from each company, so for a total of 4 focus groups. We had a semi-structured interview guide to help us with the focus groups, and they were audio recorded and transcribed. They were conducted by members of the research team that you saw on the first slide, mostly in pairs. One of them was done individually. And then we took all the data and we got into pairs and divided them up from the 4 groups and analyzed them separately and then got together as a research team to get consensus on the themes that were emerging. This was mainly to guide us in the survey development again. It wasn't like a grounded theory type of study where we were doing an in-depth analysis. We were just trying to get a lay of the land, really. And as much as possible, we took the questions and instruments that were existing in the literature to put in our survey and making sure that we covered the domains that they talked about. So we tried to find things that were easily self-administered and weren't too long, and a lot of like the national population health surveys and things in Canada are very well validated, but they're done by phone and they're quite complex and they take a long time. So we tried to pick things that looked reasonable on paper. So we actually took a diet survey from a US survey. Same with the International Physical Activity Questionnaire we used. Some job stress and general stress in workplace type questionnaires we inserted in there. We took some questions on general health, sleep, tobacco use, demographics, and things like that from the Canadian Community Health Survey, because they were appropriate. We asked some questions around healthcare utilization, and we took that from the Canadian Experiences with Primary Care Survey, so just selected questions out of there that we needed. Work-related factors, we made up some of those on our own after discussions with the focus groups, and we also, there were a couple of other studies published that gave us a bit of context of the work environment where we took questions from those as well. So we put all that together in our survey. Then to administer the survey, we actually recruited 13 companies in total, and 2 of them were the companies we were working with all along, so plus additional 11. were interested. They were all around the Southern Ontario, Hamilton area. To distribute them, we made up packages. So we put in the envelope the survey, a $5 incentive Tim Hortons card, the ethics-approved information sheet, and we made it very clear that it was completely anonymous or no identifiers in the survey. We didn't have a sampling frame list or anything like that. So we had to rely on the employee, the occupational health person, and the management or VP or whoever was the most appropriate person at each company identified to hand it out and promote it. We got some boxes that were locked and put a slit in the top so people could put their survey inside, so there would be no concern that anyone could look through a box and see anything. We had some posters made up to display in places in the offices, and we asked each company if their dispatch could send out reminders verbally while they were talking to people. So we kept reinforcing. I think a few companies did emails if they had a list, like a mass email to their drivers. So it's much promotion as they could. We got them back. We just have mainly so far done descriptive analysis with SPSS and using standard scoring methods of the instruments that are published and available. And then feeding back to the company, we have made up some profiles for them that shows some of the main results in bar graphs with their company versus all the others anonymously, so they can see where they're standing on certain things. So we're just getting those out very soon, I believe. So I'll go into the results now. We think that we did pretty good at almost 50% response rate considering this population. People were pretty surprised. We actually had given out slightly more than 1,000 surveys, 1,013 or something, but there was a batch of them in one company that got missed under someone's desk or something and didn't get given out, unfortunately. But so our denominator was kind of, we reduced it a little bit because those never really got handed out, but of those that did, it was pretty good. So as Bea was mentioning, a few striking things about the demographics is that nearly everyone is 50 and older, so a much older workforce, and even those that aren't, they're close behind. Not very many young folks that answered this anyway. Most common education around the high school or community college level, most married. Income is probably a little higher on average than the Canadian general average. Most born in Canada. And again, you can see the age reflected in 80% having worked in this industry 10 years or longer, and not many newcomers. Where they deliver to, this could be more than 100% because people could go to answer more than one of these positively, but within the city, around Hamilton, we had a couple that go to the steel companies a lot. Within the province, outside Ontario, we had one or two companies that do Montreal and back, and then across the U.S. border is fairly common too. But these were mainly short-haul companies, so people would come home in the evening, come home at night. This was the main purpose of our survey, was looking at a lot of cardiovascular chronic disease risks. So what were the risks? High salt intake by just about everybody, and this was over 2,300 a day, which is probably not surprising for everyone. Is a little more than 2,300 a day. This was people perceiving themselves to be overweight. We didn't have actually measures or anything, but about half thought that they were probably overweight. The diet was calculated using the standard scoring, which goes into 3 categories of poor, needs improvement, and good. So about half were in the poor diet area. Some job stress and about 35%, 31% regular smokers, 30% physical inactivity. We weren't sure how people answered this. If they sit 14 hours a day, it seemed like it should be actually higher, but that's what came out in the calculations. 17% self-reporting sleep problems, generally. The alcohol intake, we asked questions so that we could calculate by the low-risk drinking guidelines, and 14% came in higher than that low-risk level. So those were the major health issues. A few other things, just to show you the rest of that bar of the needs improvement and poor together. So almost nobody had good diet in this, according to the calculations. About a third are getting less than 6 hours sleep a night, which is not great for safety. Sources of stress, 2/3 indicate their work situation, like hours, traffic, lack of respect, and we'll see a little more of that in the qualitative results, financial time pressures. We asked a few questions about health-seeking behavior. What would people do if they had a health issue on the road? We didn't account for severity or anything. It's just up to them however they perceive that question. But about half would wait to see their family doctor, and about 90% do have a family doctor, so that's good. About a third would take OTC medication, a quarter would call the doctor, less would ignore, find a walk-in clinic, or consult a pharmacist. The qualitative focus group results were quite interesting in their own right, in addition to helping us with interpretation and the survey design. So we'll show you some of the actual quotes. So the major themes that we've grouped them into are stress, workplace and communication, lifestyle and family dynamic, fatigue and sleep. So under stress, there are lots of issues around fighting the traffic, especially around southern Ontario, dealing with other drivers on the road, the type of routes that are required to take, the pressure from the companies to take on a little more work when there are rush jobs to go out, the truckers' interaction with a whole lot of other stakeholders like police, inspections, the government, the fine issues, communications even with their own companies, the border, regulations changing a lot, and getting that communications in a timely manner, fine payments, and finances, as we mentioned, responsibility, a lot of it on themselves for payment of fines, parking fees, parking tickets, and all of that. So in describing what this is like for the industry to address, a couple of manager quotes, work is pulled by our customer. This is a manager describing the pressure of taking on work in the competition. So we have a trailer, we want to make sure it makes X amount of dollars in a certain period of time. Well, our customer doesn't really care. Our customer says, I want this, 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 here, it has to get done. Which means we basically, at some point in time, they want us to triple our fleet to help them out this particular week. No, that doesn't make any economical sense. So they also need to understand the rules and regulations with regards to bunk time and everything else. And quite frankly, they don't care because they'll go to somebody else. So as we mentioned, that's very competitive. And there are regulations about how many hours the driver can drive in a period of time without rest and that. So they have to take that all into account when they're trying to make up the work. We talked about the effects of the sedentary sitting all the time and what opportunities there were for moving around and addressing physical activity. So when we were talking about that, they said they spend a lot of time at companies in some places waiting to unload. They don't have a good system of a timely way of working through that in some places. So if they're allowed in the building, they have to stay in a caged area. They're allowed on the dock, they have to stay in a confined space for safety reasons. Are they allowed to walk around the yard? Probably not. They're confined. Issues with regulations. So the regulations change overnight in terms of the length of the flaps, but they're never notified, but they get fined when they pulled in. And with tires, you can't fight them. It's like, no, it was down to the wear bar. No, it's still safe. There's nothing wrong. No, it's down to the wear bar. Can't find anything, so this is what I'm going to nail you with. So there's some feeling of being really targeted, and that there are some kinds of, in the regulations, they're going to get picked on for something, not passing. Workplace and communication, there's training and regulations. Relationship with customers is a really big issue. Relationship with the employer, the infrastructure and environment that this is all set within. This is about relationship with a customer. I used to get there at 7 o'clock Saturday morning. Now this guy, he's frying eggs, he's frying bacon and everything in there. He's not thinking about going out to the crane. That crane is parked. So what do? I go and sit in my truck for 3 hours till somebody has their breakfast, then their coffee, and has a little nap. Now they go out and unload it. I don't know if that really happens, but that was how I felt to this person. That they were really kind of being ignored and their time wasn't as respected because the customer's last is always right. And they're trying to work that wait period into their day and trying to sleep at times when it's convenient, when it may not necessarily be the best time for their body to sleep. Impacts on the overall lifestyle and health. Huge effects on ability to have good nutrition in this job. Limited accessibility. You can't park an 18-wheeler in a lot of places. Limited availability. Fresh food's available. It may be very costly. No time. Physical activity. There was that 3 hours wasted for that driver who probably couldn't get out and even do any exercise, had to stay in this certain receiving area, etc. There's a certain culture of independence with a lot of the drivers, which also fosters the lifestyle habits. And it takes a toll on family life for sure. And there are lots of conditions that we would expect to be amenable to primary care and public health and workplace interventions in various ways. Parking is an issue. You can't get proper food. So you go to a truck stop and you look at the menu. Everything is like drips with grease. And if they do offer fresh fruit, it's way overpriced. Well, it's just part of a lifestyle, old school lifestyle. Like, 10 cups of coffee, 2 packs of cigarettes. They're okay, I'm good for 500 miles. So there's some acknowledgement of the lifestyle, but also it is a culture. Just to skip back to a little bit more thorough qualitative or quantitative results. Again, we saw the diet improvement and the perceptions of weight. Most perceive being overweight as well. So that they correspond with each other for sure, our qualitative and quantitative results. About fatigue and exercise, after putting in a 10-hour day, you don't want to be putting in another 2 hours at the gym, or actually when you put in a 14-hour day, you're tired. Mind you, my wife tries to get me to go to the gym all the time. And if I go to the gym, it takes an extra 3 hours of my day. I'm only getting 7 hours sleep, not even, because I've got a shower. So I lose sleep and it's not worth it out there on the road. If I kill somebody, it's not worth it. So big challenge is time management. Again, physical activity, mostly low to moderate. About half of people sitting many, many hours, and maybe some of those sitting less are on the shorter routes where they're out unloading a little bit more and more active. The family life, it's hard choosing with your family life. My wife warned me years ago not to say when I'm going to be home. Don't write that in ink. Friday afternoon, 5 o'clock, we've got to be somewhere. I call her at 2:45. Well, where are you? I'm in Buffalo, and I ain't going to make it. Like, I missed so much of my kids growing up, pageants and all that stuff. I never got to see any of it because I was always driving. But somebody's got to feed them. Fatigue and sleep, not surprisingly, relates to the work hours and the scheduling pressure. There are policies and regulations, but even still, it would be a pretty exhausting lifestyle with 14-hour days is allowed. And that's a lot of driving and sitting. And the driving does result in a different sort of fatigue, where it's not physical fatigue, obviously, it's more of the boredom and just being watching on the road and everything. Myself personally, I see myself, start to nodding off. I'll pull over and walk around the truck, take a 10-minute nap. Set your phone. You're better off having a 10-minute nap than a 2-hour accident. 17 hours is normal for myself, so not one of those trucks. The 14 hours gets bypassed lots of times, and the logbooks get fudged lots of times. So I'll be here Sunday. I'll leave here at noon. I'm at the customer at 8 o'clock. They come in at midnight. They say, okay, we can unload you now. So you lay down for 4 hours and they unload you. So it's very sporadic, kind of on and off time of working. That's the end of our results that we have to present. So if you will wrap it up.
Okay, I'm just going to briefly go over some of the knowledge to action strategies that we've implemented since we finished the survey. We applied for a CIHR planning meeting grant, and we received that, and we've had 2 report back sessions to the sector. The first was in June of 2011, and we invited people from the sectors. So we had the Ministry of Transportation was there, the Ministry of Labour was there, the Ministry of Health and Sport was there, Transport Canada was there. We invited all 13 companies. We had representatives from occupational and health and safety clinics, as well as some drivers and the research team. And out of that, we also had Dr. Baba from the DeGroote Business School come and talk about a presentation on stress in the workplace. And that really kind of set the tone so that everybody understood what stress meant, because a lot of the drivers and a lot of the companies and a lot of the business people didn't have the same view of what stress would mean in the workplace. So he was able to standardize the view of what stress would mean when we talked about it in our results. Then in October, we decided that we needed to have some kind of an action strategy. So we hired a facilitator, because it's all great to talk about research results, but they end up sitting on a shelf with no action implementation strategies associated with it. So we hired a facilitator. We invited the same people back, as well as the recommendation was that we would have more drivers attend. We needed to engage the population that we were actually doing the research with and for, as well as customers, as well as companies. So we had 3 customers that actually showed up, and companies and many more drivers. And so there was a very fulsome discussion about where they would like to go next. And it ended up being framed in kind of like the social ecological model, where you had systemic approaches, you had organizational approaches, you had company approaches, and individual approaches. And it all fit within the context of the Canadian economy and the Canadian workplace situation. So there were some wonderful ideas that came forward. And the most concrete one that ended up was establishing a design team. And in the Harvard Business Review, there's a great article that talks about design teams in the workplace, and how usually they're set up within one workplace setting, and you would bring in several different people with different skill sets to apply organizational creative thinking, innovative thinking, to come up with new strategies. We set up the design team so that we have representatives from several different companies. It's mainly 50% composed of drivers. We have drivers from non-unionized and unionized companies there. We have Workplace Safety Insurance Board representation, the research team, and some customers at the table. And some of the companies are paying for their drivers to attend that day, and some of them are coming on their own time. So there's a great commitment to this. We meet quarterly. We have simple terms of reference so that they can take them back to their workplace and share them, so that it shows that they are actually doing some things in these meetings. We've developed a work plan, and we've identified some action strategies that they wanted to work on. And one of the first one was they wanted to have a food fact sheet that would help them identify what healthy foods they might be able to choose when they pull into a truck stop, or when they're pulling into a garage and they run in and grab some snacks. What are the healthy snacks? What are the good choices? What do we take across the border? What can we cook at home and take with us and heat up in our microwaves or have in our fridges? So we developed a two-page fact sheet called what's it called? It's called grilling. What's it called? It's called chewing while driving, chewing while shifting gears. And it has very simple, all kinds of recommendations in the language that the drivers are familiar with. They're like circle checks and, all kinds of the language that they use. And we piloted it with a few of the drivers. We asked all the people that sit in the design team to take it back to their companies and let us know what worked. And so that is now being disseminated through all of the newsletters, and that many of the companies have magazines and newsletters, and we're disseminating it that way. And we've developed a website which it's called www.transporthealth.ca.com or .org. We bought all those domains. People wouldn't get confused. And we call our group TRIP. We also sent this out to the truck drivers to find out what would resonate with them. So that means Truckers Research for Innovative Health Promotion Programs. So that's what, and we've developed a little logo, and we've sent that out to the drivers. They had feedback back, so now that will be on our website. And we're going to put our research results, we're going to have the design team, we're going to have stories from the drivers on the website, and it's going to be something that they will be able to relate to, as well as researchers will be able to access for information that we are developing as well. One of the outcomes from the October event was also development of a customer survey. The companies and the drivers thought, we've given our input. We really have shared with you some of the aspects that we felt were important, and the companies also shared, and they said, we really would like to have input from customers. What are the issues that they are seeing when the drivers come into the loading or unloading dock? And there was a lot of talk about shipper-receiver code of ethics, and because they've implemented that in Australia. So really looking at what can be done to facilitate the environment when the driver goes in to load and unload, back and forth, respect to the loader and shipper, and also respect back to the driver, because lack of respect came up time and time again in the results. So we've developed a survey, we've piloted it with some of the companies, and some are more willing to distribute it than others because their customer bases, they're private. That's their income. They don't want that to be leaked in any way. So now we're looking at partnering and talking with the Ontario Transportation Trucking Association to see if they can distribute that for us. We have a meeting set up within the next 2 weeks regarding that. Knowledge transfer sessions, we've been quite busy with the results of this. We've presented at Trillium, which is a primary healthcare research, I think, for physicians in Ontario. We've presented at NAPCRG, the North American Primary Care Research out west. We presented 2 weeks ago at the Chronic Disease CDPAC, Chronic Disease Prevention Alliance in Ottawa. We presented we're presenting in April at the Ontario Public Health Conference. We're presenting in the Canadian Public Health Association Conference in June out west, and we're presenting at an international conference in Israel in June as well. So we're really trying to get our information out there through all methods, at the research level, at the organizational level, and to reach the drivers as well. And we're looking at collaborative integrated workplace wellness research projects. We're partnering with the public health division to look at the integrative model, where they're looking at occupational health and safety being integrated with health promotion initiatives to produce more of a occupational ergonomics approach. So potential action directions, as I mentioned, they're covering from the systemic down to the individual levels. There was a great deal of interest from the drivers to look at individual health literacy approaches. Health literacy has been identified as a new determinant of health at the CDPAC conference 2 weeks ago. So there's a lot of focus on helping people to navigate the system, to understand. And most of the drivers are older, so they probably more likely have comorbid conditions. And to understand how to implement that regimen into their work life in terms of their lifestyle in the truck can be quite complex. So health literacy is a hugely important new initiative to start looking at. Company corporate workplace wellness approaches. As I said, we're looking at that integrated approach, reviewing the literature right now. How can we work better with companies, particularly in the transport sector? Customer approaches. We hope to be able to do the customer survey dissemination to get that approach, and then we'll bring all of the partners back together and say, this is what the customers are saying, this is what the companies are saying, the drivers are saying. How can we work together on this to implement a workplace that's healthier and safer for all? The policy, government, regulatory approaches, as we heard, there was a lot of difficulty with communication issues between regulations changing and the communication being disseminated to the independent drivers. And about 96% of drivers in Ontario are independent, so they contract their work out to the companies. So getting that information out to them in a timely manner so that when they pull into the weigh scale, they don't get fined a $3,000 fine because their flap is a quarter of a centimeter too short or too long. So communication is huge. Also, what came up was we need to work better with the food stops along the road. We need to look at the companies that are running those food stops so that perhaps they could implement some programming at that level where the drivers are stopping. It came out time again that the drivers love their job. They love the independence. They feel that the other drivers are like family. And so there is a real culture. So we have to identify how we can work better with them in a more timely manner so that everybody is satisfied. And we're looking at developing a coordinating collaborative. This is not a project that is a project anymore. It has become a collaborative program. We have people interested out in the East Coast. The Atlantic Trucking Association is very involved with research out there. We're linking with Michelle Johnson out there. And in the BC, Northern Health Unit is also very engaged in working with the logging truckers out there and really want to work with us on the health survey. We do hope to do a national survey That's our long-term goal, to do a national survey incorporating more elements regarding the musculoskeletal issues and the HIV issues. This was just a pilot survey that we did, so we chose something that would be less threatening for the drivers to talk about. HIV is a very personal, private issue, and there's a lot of international research that talks about the amount of HIV and sexual transmitted diseases among truck drivers. And in ergonomics, there's been lots written about the musculoskeletal strains and sprains among truck drivers. So we would be incorporating some of those questions in a national survey. So conclusions, our results showed chronic disease risks and modifiable lifestyle risk factors related to working conditions. Collaboration with stakeholders will help inform the worksite policy interventions and offer an evidence base for programs and policies to improve health and safety among these high-risk professional drivers. And engaging with community members and community organizations will help to assess and enhance the system's capacity to deliver equitable health services and programs. Thank you.